On April 1st, 2015, the 9 former district health authorities in Nova Scotia became one Nova Scotia Health Authority. So as you can appreciate, we went through enormous organizational change, and we continue to go along that journey of organizational change. And I think what's been helpful is that we have, because we were going part of this case study, we had some tools that we were able to make available to staff and others and leadership during this great time of great change. And in fact, it's actually strengthened the argument as to why we need to be paying attention to the standard and supporting its adoption into the workplace. In the health sector, we are a 24/7 operation, dealing with complex cases, last-minute life or death situations. It's extremely demanding job working in healthcare. And I think that healthcare workers devote and dedicate the care that they provide to their patients. So they do everything to create the safety of the patients. But often we don't recognize how it affects them, how the delivery of that care in a timely, efficient manner affects their ability to care for themselves. So I think it's something that's not often talked about in healthcare. And I think we are a sector that now has really started to turn our minds to how do we support the health and well-being of our staff, which includes psychological health in the workplace, and allowing our healthcare workers to be able to be courageous enough to talk about their mental health in the workplace. In 2011, we really started to look at the number of short-term illness claims that we managed within our organization, and we saw a large increase in mental health-related problems or illnesses. About 50% of our claims were related to mental health problems or illnesses. At the same time, we brought a steering committee together to look at mental health and addiction strategy for our staff. So that was one of the first 2 key pieces we had. My advice would be is to look at, you probably are doing lots of things already, so to have an interior look at what you're doing now, critical look at your programs, what can you enhance, and then really looking at what can you add. Programs like the Working Mind or Mental Health First Aid are great examples of complementary training. And I think it's important to recognize that we need to provide training to our staff, not only to our managers and supervisors, but to our staff and how they help each other in supporting and creating a psychologically safe workplace, and that they do have a role to play. So I think that also having a commitment by leadership is extremely important. We are very fortunate in the Nova Scotia Health Authority, where we have a CEO who is extremely engaged in the health and safety of our staff, which includes psychological health in the workplace. And that has made all the difference because people pay attention. Not only does she talk the talk, but she walks the walk. And that really helps put our programming at the forefront to others to say that this is important.